to Bethany TV for Health. My name is Dorothy Ainem Babazi, and today on Health and Wellness, we'll be talking about dental health care. In the studio, I do have a female dentist for the first time. I'm so excited. She's so beautiful. I think that is also called doctors?
Yes.
Dr. Angela Kisa, who is here with us in the studio, and we'll be talking about dental health in depth. I know people don't take dental health as serious, but trust me, it's something that you all need to know and take care of yourself. Dr. Angela, welcome to the show.
Thank you.
Thank you for looking smart.
Thank you. You look good as well.
Thank you. Please introduce yourself to the people.
My name is Dr. Angela Kisa. I am a dentist and I work with a practice called Code Clinic located at Kira Road in Kamot.
Oh, do people afford that name? When we said Kira Road, for like, that code.
You know, when the teeth
Yes.
are a priority, you can afford.
Very true. Everyone deserves a good
Yes.
smile. Well, today we'll be discussing about dental health. How briefly can you describe, how do you make someone understand dental health or dental care?
Well, so dental care understood in like a simple way is generally taking care of your teeth, right?
Okay.
But just to expound on that, dental care goes beyond just the teeth. It is the mouth is the gateway to the rest of the body, and so dental care is like important to the general health of a person. Yeah, so it's taking care of your teeth so that the rest of your body can remain healthy. Yes,
Just
so it's
general. Okay.
generally just cleaning your teeth, making sure they are okay, eating the right things to strengthen your teeth, generally taking care of your teeth.
When you mean the teeth, the mouth, you mean the tongue as well?
Yes, everything in your mouth. So like dental care is not just teeth, because when you say dental, a person will just think teeth, but it's everything concerning the mouth, because again, it affects the general body as well.
Okay,
Yes.
Thank you so much. When we talk about dental care, now that you're talking about generally the mouth, the teeth, and the tongue, what are those damages or what are those effects that usually you as a dentist call effects that affect our teeth or our dental hygiene?
Just so I can understand this well, do you mean things that affect the teeth, like problems of the teeth? Or
No. What are those things that we do that affect our dental hygiene? Yes.
Well, those are a number of things. First, I'll start with diet. The things that you eat affect the health of your teeth. At Code Clinic, we have a saying that if it doesn't go bad, it's bad for you. So anything that can stay on your shelf for more than a day or two is really, you already know that it's going to endanger your teeth. Okay. So that's diet. These carbonated drinks, the sodas, the very sugary drinks, the biscuits, ice creams, all those things.
Chocolate,
yes,
name it.
Yes, all those things, because the bacteria feed on those to now, release acids that now break down the surface of the tooth, causing what we call a cavity, that people call a hole. Yes, so those things are not good for the teeth. Next is the hygiene of the teeth. Okay. So that's brushing, flossing, going for your dental checkups regularly.
Mainly those diet, checking, going for dental care, and avoiding sugary eats.
Those are the main things that affect our teeth. But there is other things that are usually a person can't control, like maybe their jaws are not functioning properly, and so you find that they probably grind their teeth, or that they breathe through their mouth, and so they are exposing their mouth to a lot of bad bacteria, as opposed to breathing through their nose, which is supposed to cleanse air that is coming to your body. So those are usually out of people's control, but that's the importance of now the regular visits, so that the dentist can advise you better.
Okay. Now, you talked about diet. Please explain. Usually doctors here tell us diet. So how does the diet affect my teeth? The matoke I eat, The pizza, the chips and chicken,
Yes.
the greens I eat. Which diet are you trying to mean exactly?
So, like I said, if it doesn't go bad, it is bad for you. That means that it has so many additives in those things that are trying to preserve it that are not natural contents, right? Now we know that carbohydrates, proteins, refuges, water, all those things are good for the body because they build it up, they strengthen it, they help it fight against diseases, right? Now, on the contrary, the things that are carbonated and have preservatives, now let's say like soda, those things contain a lot of sugar, right?
True.
Now in the mouth there is good and bad bacteria, right?
Oh, yeah.
Well, we're not born with the bad one, but along the way, because dental problems, and a person is not born with dental problems, you're born with a clean slate, right?
Oh, true.
And then along the way, you start to get these things. So let's say a mother has a cavity, they kiss their baby, transferred cavities.
Oh, true.
Your child goes to school, takes water on a bottle of the child whose mother kissed. Cavities.
The cavity moves on.
Yes.
Oh.
For couples, you kiss your partner, they have bacteria. Yeah, so all those things are how a person gets this bad bacteria, right? Okay. Now, when this bad bacteria gets into the mouth, it has to thrive on something, right? Now, sugar is their main thriving component, right?
Yes.
So when they get that sugar, they break it down into acids, right? And these acids now are bad for the surface of the tooth because they will break it down. When they break down the surface of this surface, for example, the tooth has different layers. Now, the topmost layer, which is supposed to protect the rest of the contents of the tooth, is called the enamel. Now, if the acids burn that enamel away, then now the bacteria have direct access into the rest of the tooth. And they'll go on eating it away until they reach the part that is the one... Is
that the gum?
No, not the gum.
Yet.
Now that part is called the pulp, right?
Okay.
So they'll get to the pulp, and then now that's when you find that a person has this severe pain, headaches, can't sleep at night, things like that. The tooth
they can no longer take cold things.
Yes, hot things, all those things. So now the tooth is gone. But also, there is another dimension of the gum, right? So now again, when these bacteria are overly concentrated in the mouth, they are going to affect the gum as well.
Oh, yes.
And they're going to make it sick. That's why you see some people have some bleeding when they brush. That is not normal. It's not supposed to be there. When you brush your teeth, you should just spit out the contents of the toothpaste, right? Not the blood. So anytime you see blood in your saliva when you spit, just know there is a problem. So that means that the gums are also affected. And when they are sick, then, you know, they are affecting, first of all, the general health of the person, but also the gums hold the tooth. They help to hold the tooth firm, right? So if they are eaten away, you're going to find that the tooth now is also loose. And then if that continues, you find that the person can lose the tooth because, you know, it's not... It's
already damaged.
Yes, it's already damaged, but also it's not being held. So...
Oh, that was so insightful. Now, when you talked about the pulp as like science, well, you're still watching Health and Wellness, which happens every Saturday from 8 to 9. My name is Dorothy. In the studio, I do have Dr. Angela Kisa from Cord Clinic. Bethany, mainly, they major in, our dental care or our health as well. We talked about cavity.
Yes.
What is cavity and how can you describe to us cavity?
Because
some people call it a hole.
Yes, just to put it plainly, it's a hole in
a
your
tooth.
tooth. Yes. So ideally, the tooth should be, intact, nothing, deep. It's just a hard surface, right? Protecting the rest of the tooth from anything entering, right? So if anything tampers with that hardness of the surface, then that's a cavity. It's caused by the bacteria eating up, that hard surface of the tooth and entering into the rest of the surfaces of the tooth. And so how you can identify that you have a cavity can be maybe you have sensitivity to hot and cold things, right? You have sharp pains that just come out of the blue, like you're there, something comes, or it's triggered by when you eat something, right? Or you feel sensitivity to things, or you have sleepless nights from a tooth hurting and you can't, you can't eat from one side. So those are ways that you can identify a cavity. Another way is bad breath, right? So
sometimes we think people who keep quiet are the ones that have bad breath. It has always been our saying.
That. Yes. But also a person that has a cavity can have bad breath because, again, the bacteria have settled. They've made a home now in that hole, right?
Okay.
And they keep on eating it up, and they keep on accumulating, and they keep on reproducing, and so that can give off.
Wow. Okay. Usually it's hard to tell someone you have a bad breath.
Yeah.
Since you're a doctor.
I can't describe it, but you can tell.
You can tell.
Yes.
Wow, you're so bold. But anyway, now that we've talked about the cavity, the diet that usually would affect, or the problems that would affect our dental health care, or our health, sorry.
Yes.
How often should one visit a dentist?
Well, as often as you can, but we recommend at least 2 times a year, right?
Wow.
So we advise that, every 6 months, go see the dentist, right? Because these 6 months will give us time to actually, if let's say a cavity is developing, we can capture it. If your diet has changed between now and, the next 6 months, it will be easy for us to capture a cavity before it reaches the pulp, right? And so we can deal with it because, again, the more the cavity progresses, the more expensive it is to treat it, but also the more painful it is for the person. So these 2 visits allow us to, do a thorough check, do x-rays, find out, are your gums bleeding? Are you okay? Yes. And so they help us curb anything that would otherwise would not have been seen if, you hadn't gone to the dentist. You see that a lot of people go to the dentist when they have pain.
That's how it does.
When they didn't sleep last night, that's when they go to the dentist. But you should go. Imagine if you had to go to the dentist every twice a year just for a checkup. It's, let's say, let me just give an example. A checkup is 20,000 or 40,000, right? You go and do that every 2 times a year. That's, let's say, 40,000.
Yes.
But if you keep that to you, like if you don't go to the dentist, if you don't ever go to the dentist, you go and then you have maybe to do a procedure that is going to cost a lot of more money that you could have avoided. But also now it would have affected your general body, your general
income as well, because you didn't plan for teeth to get affected. Now that you have talked about how often we should see our doctors, twice a year. At least.
Yes. And, that's subject to the doctor, right? Because let's say if you have a severe gum problem, we could recommend that you come every 3 months. And so, that's subject to the doctor.
True.
What we want to do is make you feel, better, live healthier, have a better life, right? So what we'll assess what your mouth looks like, and then we shall recommend how often you can come.
Very true.
Until you get to a place of 2 times, because that's the ideal.
I usually love kids. I love babies a lot. I would want us to, talk more about the children. Very many parents are reluctant in taking their children for dentist visits. And we have seen when kids get sick, syrups.
Yes.
Sometimes we leave them at home with, people that take care of them. They even forget that they have to brush because they'll be like, these are kids. They can eat. They can work. So they forget that these kids have to brush. You have to call and remind them, did my daughter brush? Did my son brush? So what are those things that parents should watch out as well for their children to ensure that their cavity is kept well, especially with what they take in? Sweets, syrups.
Yes.
I don't know. It's a lot. Soil. They eat a lot of things that some we can't control. Yes.
Now, like we said, again, as applies to the adults, same as to the
children,
kids. Because now for the kids, you actually have to be extra careful because for them, they don't have these things yet. So it's up to you to actually ensure that your child lives a cavity-free life for the rest of their life, because it's possible. It's possible for a person to go through the rest of their lives without having a cavity.
True.
But that depends on how they have, been raised. What have they been fed on? how has their general hygiene been.
True.
Kids start to develop teeth at about 6 months, right?
Yes.
That's when you start to clean their teeth. The moment those teeth erupt, start to clean them. Don't be like, let me wait for all the teeth to come, then I'll start. No, even these teeth that are starting, they are also important.
Yes.
And a lot of parents, say that, these are primary teeth, they'll come out,
shall grow
and
others.
Then we shall grow others. But if the primary teeth have been affected with bacteria, the adult teeth are going to be affected with bacteria as well, because it's the same mouth. Oh. The bacteria doesn't come out with each tooth that
we thought that's what happens.
No.
Okay.
Remember, like we said, a person is not born with this bacteria. This bacteria is introduced to the mouth, yes. Right? It's transmitted from, different sources.
Yes.
So that means if this bacteria is introduced into the mouth, it is there now. If you don't deal with it, it will stay for even stuck. When the adult teeth come, it starts from there. So it's not that every tooth has this particular bacteria. So we remove the first one, that one has gone. You have left yes, you left the bacteria in the mouth. So the parents need to stop saying that the teeth will grow. The primary teeth are as important as the adult teeth. Otherwise, we wouldn't have to sit. We would just have all our teeth and we chill.
Okay,
yes.
That's very insightful. Now, talking about how many times should we brush? I think that everyone was waiting for that moment. They'd be like, okay, we have understood now. Can we move to how often should one brush?
Yes. So I like to use at least.
Okay.
At least. So I'll say at least twice a day, right?
Okay.
But ideally, every after a meal, brush.
Breakfast? Brunch? No, there's no brunch. No, in an office and you're bored, you throw in something. Lunch?
Yes.
Evening tea?
Yes. And now
dinner.
those mid of the day snacks are the worst because they are the ones, first of all, they are never healthy snacks.
True.
They are usually, something that is off the shelf.
Yes.
So those ones are the ones that cause the most problems. So if you can avoid them, just let them.
So we brush twice
go, but ideally,
twice a day, sorry.
I imagine because even for kids, they have to go to school, come back in the evening. There'll barely be a window to brush. You're at work. You'll probably not get a chance to go and brush your teeth. But if you're able to, please brush every after meal. But ideally, morning and before you go to bed.
Wow.
Yes.
Now, since you've talked about the brushing, there are different types of brushes that people recommend. And as we're talking about the types of brushes, how should one brush? Because now that you have the brush, yes, but there's that forceful and then there's that softness. Yes. So I need you to explain to us that we understand which types of toothbrush we have.
Teeth models so that I can demonstrate
I've seen most of them.
But
they're very expensive though. But you shall go on.
So we recommend that a person uses a soft toothbrush, right?
I use Oral-B, I think.
Yes, it has
best
good toothbrushes as well. But there is a difference between hard, medium, and soft, right? Okay. There is different strengths of the bristles.
Okay.
So a person should use a soft toothbrush because if you use a hard toothbrush, over time, it's going to wear off the surface of the tooth. The misconception is that when you use a hard toothbrush, it's taking away all the dirty things. Yeah. It's cleaning away everything. But the sad truth is, the more you use a hard toothbrush and the more aggressively you brush, the more you're wearing away the surface of the tooth. Okay. Now, a soft toothbrush can do the same job, and it can do it well. You just have to have the proper technique of brushing.
What is the proper technique, doctor? You forgot your tools.
I forgot my tools, but I will just say something that is easy to do. So, brush in circular motions, right?
Oh, yes.
To ensure that you are covering all the surfaces of the tooth. And then when you get to the back of the tooth, you inch the toothbrush a bit so that it's getting into the
extreme teeth.
Yes, the extreme teeth and into the middle parts of the teeth, because those are where the food traps mostly. And every after you brush your teeth, also brush all surfaces. I have spoken to people before that tell me they only brush the front teeth, right? So even the back side of the tooth is supposed to be brushed because a cavity can develop anywhere. It's not limited to, I only come to the front or when you come to this, or when you come to this surface that bites, it can go anywhere. It can go near the gum, it can go between the teeth, it can go on the surface of the teeth, it can come to the front. So all surfaces of the teeth should be brushed equally, right? And take your time while you brush. Don't brush for 2 seconds. Yeah?
Then, we have matches that have started. You're trying to brush.
You have to take your time. Take at least 2 minutes brushing. 2 minutes is a long time.
It is.
It's a long time. Because, you just go, then you're done, right? But every surface should be brushed, and do not forget the tongue. Please do not forget the tongue. It's equally important because, first of all, if you don't brush the tongue, the bacteria traps at the back there, and that's what causes bad breath, right?
Oh, yes.
And then make sure that when you brush it, it's supposed to be a pink-ish, right?
Oh, yes.
So if you don't see your tongue become pink while you brush, it's probably still that. If it's still white when you brush it, unless it was bone white, which is very unlikely, yes, it will. Just make sure, look in the mirror, take your time brushing your teeth. It's as essential as showering.
Very true.
It's as essential as putting on lotion or putting on your dress, because if you put on your dress and your teeth are not properly brushed, it's
a danger.
So and always floss after brushing. Always floss.
Dr. Faswet, we shall go for flossing later. You're still watching Health and Wellness. Dorothy is my name on Bethany TV for Health. Now, today we're talking about dental hygiene. Dr. Angela is here to elaborate more. She has elaborated how we should brush our teeth in circular form or formation as well. And she has circular, but behind, in front, the tongue as well. Please don't forget to brush the tongue. Now, we have also talked about the toothbrushes. The hard, the middle, the soft. How can someone tell? I usually see babies' toothbrush and I'm like, well, this one clean, really. They're so soft. And then you as an adult, you're like, this can't clean me because you feel like you're old, and maybe the things you eat as well, they're really hard, compared to the children. So how do you describe which toothbrushes should one, get? Well, the soft toothbrushes have soft bristles, those little things on the toothbrushes. They're usually soft, like you can take your hand through them and they just go, right? The hard toothbrush, especially now, like, okay, I will not mention. Oh, yeah, we should not mention.
Yes. The hard ones, like, it can't move, but then again, when you're buying, you cannot know that because the thing is
all closed.
So usually there is an inscription on the toothbrushes. There is soft, there is usually written soft, there is medium, and there is hard. So when you go to look at the shelf, choose the soft.
Oh, there's a picture on the screen as well. Wow.
Yeah.
Oh, yes. I think the babies are the ones that use where there is pony.
Yes.
Oh, okay, yeah. Okay. And now that you've talked about the toothbrushes, toothpaste. People have talked about toothpaste. I think we have how many types in Uganda? Number of them.
There's a number.
But when one goes to a shop or to a supermarket on the shelves, which type of toothpaste should they look up for? Especially the words that, are in that product of the toothpaste they should use.
So what I usually tell people is that look for a toothpaste that has fluoride.
Fluoride.
Yes. Okay. Fluoride. Say it again, fluoride.
Fluoride.
So when you go to look for a toothpaste that has fluoride, because that is a component in the toothpaste that keeps the teeth from bacteria infestations, but also it strengthens them and protects them from, strengthens them from the acidity of, let's say the bacteria will produce from all these sugary and starchy things. It will protect the tooth, right? So if you have a toothpaste that you are using regularly that has fluoride, you have higher chances of preventing cavities than a person that doesn't brush or doesn't use a fluoride containing toothpaste.
Wow, that's important. There are myths that people should brush with boiled water, not boiled water. Now, if I use boiled water, I have to buy water every day. So please advise, how is it important for one to use boiled water or unboiled water while brushing?
I don't think it's important. It's not important to use boiled or unboiled water because you don't swallow the water that you use to rinse.
Eh?
But for kids, I would recommend boiled water because sometimes they swallow.
They enjoy swallowing.
Yes, and that's why for a kid you should put a pea-sized toothpaste on their toothbrush, very little, so that in case they swallow, they are not going to ingest a lot of fluoride, because that can also affect them, right? So for kids, please, if your kid struggles with spitting, use boiled water, because again, if they consume unboiled water, they are going to get sick. But for adults, there is no need to use boiled water, because you're not going to swallow. You brush and spit.
Okay. Yes. Thank you so much, Dr. Angela. We're going in for a commercial break, but as we're coming back, we want to talk about the sensitive teeth. We have had people do whitening. We have seen bracelets. A number of things are coming, with dental hygiene. So we shall be, talking about that after this commercial break. It is still Bethany TV for Health. We'll be back.
Bethany TV for Health. Are you ready for this good news? You can now watch Bethany TV on your TV, AfroMobile, and Airtel TV apps. Yes! Catch the finest programming prescription for everybody, wherever you are, whenever you are. Bethany TV for Health. The Higher Life. The era of the world revolution, with Apostle Dr. David Kunawa and Pastor Rita Bella Kunawa of Rivers of Life Assembly International, Boston, Massachusetts, USA. Streaming every Tuesday from 8 p.m. to 9 p.m. East African Standard Time, with the incorruptible, incomparable, and revolutionizing, life-transforming Word of God. Only on Bethany TV for Health.
Child health and well-being, the foundation for a bright and promising future. Join us for exciting episodes aimed at optimizing our children's physical, mental, and emotional health with our team of experts, including pediatricians, nutritionists, and child psychologists, every Wednesday at 8 p.m. on Bethany TV.
Bethany TV for Health. Every day at lunchtime, we bring you back-to-back inspirational music videos. You request your favorite gospel music video, and we play it on the playlist. To request, go to our socials: Facebook, Bethany TV UG, and Twitter at Bethany TV. Like and follow, then type the name of the song in the comment section of the playlist post of the day by. Get ready to celebrate all things manly. The Chord. The ultimate destination for men to explore, discover, and conquer. Interests, passions, and pursuits. Ready to level up your game? It's time to drop the stereotypes and demystify what it truly means to be a man. Excitement, inspiration, and brotherhood we share. Take charge, live life to the fullest, and become the man you've always wanted to be. The Chord, where men thrive. Every Monday, 8 p.m, live at Bethany TV with your hosts, Keith, Patrick, and Livingstone. Bethany TV for Health.
Welcome back from that short commercial break. It's still health and wellness. My name is Dorothy. Bethany TV for Health is always here every Saturday from 8 till 9. Today I'm delighted to be having a female dentist, guys. I'm still in shock, but yeah, I've woken up. She's called Dr. Angela Chisa. And before we went for a commercial break, we're talking about how one should brush. Why is it important to brush? But something that someone wanted to know exactly, why do you dentists tell us to brush in the night? Like some people be like, I haven't eaten anything. I think I can just take water and sleep. Why is it really, really important to also brush in the night?
Yeah. So now, if you last brushed in the morning,
Yes.
right? You have been eating all through the day. That means things have been these food particles have been getting stuck in your teeth. Then you have dinner, more food, maybe have more soda, more food in the body, and so you go to bed and you haven't removed these things.
Yes.
Now during the day you can take some water, clears away. The saliva production during the day is more active, right?
Yes.
Because you're speaking, you're doing this and that and that. Now at night the saliva production reduces because you are asleep, right?
Oh.
The body is resting. Now saliva is supposed to help to cleanse the mouth, right? Neutralizes the acids from the bacteria and a lot of other things. So if the saliva production has reduced and the amount of food that has been trapped in the mouth is a lot because it hasn't been brushed away, that means that the bacteria are working overtime. They are secreting more and more acids. And when that happens, that means that the acids are going to increase. The amount of acids in the mouth is going to increase, and so that can cause more
Damage to the
teeth.
Because I've seen most people complain when their teeth are paining in the night.
Yes.
So they wake up with that pain.
Yes.
But during day, it's very rare to find someone complaining of teeth, of a tooth problem or tooth decay.
Well, also at night now the vessels and the blood are it's more concentrated in particular areas, right? And so it can cause more pain because when you're moving, let's say the blood is flowing and it's moving and all
You're
of that.
moving your body basically.
But when you are sleeping, if it's around that place, the acids are more, the bacteria are, because the blood has components that fight against this bacteria, right? If they are active, then but if they are not, then that means that the bacteria are going to work overtime and cause more pain.
Wow. Now, before we went, I was talking about sensitivity or the sensitive of the teeth or the tooth. How does one tell that they have sensitive teeth? If they came to the hospital, how would you tell? By what they tell you or, as you check up and,
Well, you can check and find out. Usually, sensitivity is to either hot or cold. So if you blow air on the tooth, the person will maybe jump and have like that jolting pain. And if you put water there, they'll, react a certain way. So you watch how the person reacts.
Yes.
But even for people, when you take maybe cold or hot things, there is a way that your tooth feels kind of like a sharp pain that almost disappears instantly when you remove the cause of that pain, but it's like a jolting kind of pain. It may not even be pain. It's like repulsive.
You've reminded me of something of when you were in class and someone got a chalk and passed it on the on the board that pain that would kind of so that's the pain that you feel.
That can a bit describe sensitivity. Yeah, but then sometimes it's more than even that. That is irritating.
Okay.
This is actually, it can be painful sometimes, especially.
How is it fixed?
So this sensitivity can be caused by a lot of things. So most things are fixed according to their problem, right?
Oh.
Yes. So if for example, the cause of your sensitivity is because there is a cavity that has reached, let's say, the dentine of the tooth, that will be fixed by, cleaning up that cavity and putting a cement over it. Then you will not feel sensitivity anymore.
Okay.
If the sensitivity is caused due to wear away of the surface. Now we find out what is causing the surface to wear away. Is it aggressive brushing? Is it a lot of acids? Where are these acids coming from?
Yes.
Now, does this person have acid reflux? Do they have heartburn? Do they consume a lot of acidic drinks? Do they take a lot of lemon water to lose weight? Things like that.
Doctor, leave us with our lemon water. So you're going to tell us to stop taking lemon water again?
Well, it's not healthy for your teeth.
Oh, okay.
It's not healthy for your teeth because
of
the
the
acids
acids.
are very corrosive for that.
So we shouldn't even eat pineapples because it has acids.
Yes, it has citrus acid.
Doctor.
So,
Okay.
but no, you can eat those things, but you can, neutralize them with something that, is going to neutralize the effect of the acid.
Of that effect, okay.
Yes, but also you can watch the frequency of which. If you eat pineapples from morning to evening because you're chopping weight,
Yes.
your teeth are going to die.
Yes, true.
Yes, so you can find a way to have a balanced diet. Yes.
There are people who will say, Doctor, my mouth smells. No cavity, my mouth has failed.
Yeah.
Which advice do you give such people?
Visit a dentist. Visit a dentist, find out the cause, because there is many causes of bad breath. There is, like I said, cavities. There is poor oral hygiene. It could be because of, acid reflux. It could be because of a very dirty tongue.
Or just someone generally dirty.
Yeah,
You don't know how to clean yourself.
You just don't know how to clean yourself. You don't know how to brush
People
your
don't know
teeth.
how to accept that.
Yes, sometimes you're not. Some people, let's say that people that are on a lot of medication, it kind of affects the saliva production in the mouth. And when the saliva production is limited, then that means that, remember we talked about the acids and the bacteria and all of that, and so that can cause bad breath.
Oh, okay.
So the best advice I can give is go see a dentist so that you can get to the bottom of the
that bad breath.
the cause, and then you can move forward from there.
There's a new, to me it's new, the whitening of teeth. I see people go for whitening, I see people do this, then there is shaping. I remember people used to tell me, you do have rabbit teeth. I think you should go to doctors and they shape them.
Yeah.
I'm like, guys, are they going to file them? Are they going So give us a picture.
Yeah.
What do you mean by whitening and why do people opt for whitening? And what is it all about?
Whitening is basically, it can be both cosmetic and, it can be treatment and it can be cosmetic. It's mainly cosmetic because, people want to have a Hollywood smile and, brighter teeth. Sometimes people's teeth have been stained due to a lot of things. Smoking, coffee, drinking, a lot of things, right?
Others eat a lot of tea leaves.
Yes, which again, when you visit the dentist, you can understand that what you need is maybe not whitening, but cleaning, right? Because sometimes a person looks at the stains on their teeth and thinks, okay, I need whitening. Like when I go and they whiten the teeth, this will all go away. But yet, in actual sense, what you really need is the teeth to be cleaned, scaled and polished, and then they'll go back to their normal color. But whitening is basically brightening the color of the teeth from their normal color, which is their natural color is not white, pearly white. That's not their natural color. They tend more to, off-white, creamish, right? So whitening is basically improving that, brightening them from one shade to another, and that usually can be done by doing teeth whitening in the office, or for some people, they just do, they add like things to their teeth like veneers or crowns where they will remove a surface of the tooth and put something that is a specific color. Like a person will come to you and tell you, I want this white.
This one.
So some of that white can't even be achieved by whitening. So you give other options.
Other options.
Yes, but it's mostly preference of the person.
Are there dangers?
Well, not really, not anymore. The whitening products have desensitizers, which was one of the reasons that people would opt out of it, because they'd be like, oh, my teeth are going to get sensitive, these products are corrosive and stuff like that, but they have desensitizers in them. So when a person whitens their teeth, now there is no effect. So you can whiten your teeth.
Is there any particular age? Because now for me, if I want my daughter, she's a model, I want to whiten her teeth. Is there a particular age you'd be like, no.
Yeah, well.
There's a type of, there is a level where we would accept, or there is one that would be like, just keep on brushing your teeth. Yes.
So we recommend after growth, right? After that person's teeth have fully developed, then you can start to do other things on them.
That you really want to do.
Yeah, but like for a child, it's very unnecessary. Let the child grow.
Yes.
Yes.
Okay. Now we talked about whitening. There is another thing, the bracelets. Back in the days, when we saw people wearing bracelets, we'd be like, oh yeah, maybe they have a disease. Maybe we didn't know what exactly it was all about. But what is it all about?
As you can see, I have.
They look beautiful.
Braces.
Yes,
They're called braces.
Not bracelets. The bracelets are the ones that wear the braces. My bad. Braces. Yes.
So braces are treatment for teeth that are not aligned properly. So that can look like crowded teeth growing on top of each other.
Okay.
That can look like teeth that are not biting properly, biting either behind each other or way ahead of each other. You've seen people with very protruded jaws, or
I have
jaws that are, again, like backwards. So braces treat those. They fix teeth. They make them be in the natural bite, which is upper teeth slightly, upper teeth, lower teeth slightly behind the upper teeth, and not crowded. And that is not just for beauty. It's also
sometimes it's beauty, doctor.
Sometimes it's beauty. Most times it's beauty. Like a person goes because I don't like my smile. But
true, yes.
Again, it's a lot more than what we go knowing. It's if your teeth, let's say, are not in a correct bite, you are going to be grinding your teeth. You've seen people that grind their teeth.
Okay.
Right? And when you grind your teeth, you will find that now the surfaces of your teeth are wearing away, and now you have sensitivity, right? So it's one thing leads to another.
Yes.
So it as much as you go knowing this, the dentist can educate you on what else could have been the problem, and even motivate you to do those procedures better. So it's a lot more than just cosmetics, a lot more than just looking beautiful. It's functionality as well.
Dr. Angela is still here with us. She's a dentist, and we're still talking about dental hygiene or understanding dental care. There are sayings or there are myths that are also around dental, care.
Yeah.
One of them is some doctors advise, patients not to remove their teeth, maybe to cement them. Then others, you'd find like they have broken and they're, non-repairable. What are those dangers of having your teeth or your tooth removed? And what are those, advantages of cementing the teeth so that it can keep more for some good time as you're still using it? A person naturally has, an adult has naturally 32 teeth, right? Yes.
So it's best that you leave those teeth in the mouth because they all have their functions, right?
Yes.
For example, the incisors bite into food, right? You will not bite an apple from these ends.
You have not seen someone who loves apples. They will bite it anyway.
If they don't have these ones,
you won't bite it.
Yes. It will be hard to bite. Yes. The canines will tear into food. You'll bite a piece of meat like this, right?
Not
as
like
opposed
this.
to like
like
this. Everything has their function, and then these ones will grind the food and make it soft so that digestion is easy, right? So each tooth has its function, and so we always want to keep the teeth in the mouth, right? Okay. And only remove them if there is nothing else that can be done for them, which also happens a lot of times.
With age?
With age.
Because we see grandparents, eventually they start losing their teeth and they become now the babies. Like we
there is that, but also when let's say cavities eat up the tooth, overly eat up the tooth, you can find that the surface has really been eaten away. There is nothing that you can build on, so that tooth can come out, or it can break in a way that cannot be repaired. So then you can remove the teeth. But also affordability. Sometimes a person cannot afford to do, let's say, a root canal or a cement, and all they can afford.
What is a root canal again?
So a root canal is when your tooth, so remember how I told you there is enamel, and then there is dentin, and then now you get to the pulp.
Pulp, yes.
That part, where the one that feels all the things, where the blood, the nerves are, and the vessels, the blood vessels are. So when you get to when the infection gets to that part, usually it's a place of irreversible damage, right? So you cannot put a cement over a pulp that is infected, right? It will cause more pain. So then the best thing to do is now remove the pulp, so that the tooth is not feeling these teeth and these things anymore. Then cover it with a cement or a crown so that it maintains its function. So then you're not losing a tooth. It's still there, it's still eating, but also because if you lose a lot of teeth, your jaw is going to be disfigured, because again, the anatomy is supposed to be a certain way. The teeth are supposed to be a certain way, because otherwise that's when you find a person's jaw has sunk in. That's how you find all people, the face is more inside than it should be, because they've lost their teeth. So it's both aesthetic and it's also functionality. All the teeth have their functions.
Their functions.
Yes.
Now that you've talked about that, I mean, would want to know, how can we keep our dental care in a proper way? There's flossing.
Yes.
Because we've talked about brushing, taking water, avoiding foods. There's a new flossing. Wash mouth. How does wash mouth help us? Now that I've brushed, why would I use the wash mouth?
Okay.
Yes.
First, flossing.
Yes.
Talk about flossing first. Brushing. How can we maintain good oral hygiene? So first, brushing. And we said at least twice a day. At least.
Not a week.
To. Not a week. A day, at least twice a day. And using, ideally, a soft
toothbrush.
A soft toothbrush and fluoride-containing toothpaste.
Yes.
And we're discussing here in the break that the soft toothbrushes also have an added advantage, because they can go through, into the surface.
In between of the teeth.
In between the teeth, especially for people that have some spaces between their teeth, they can go in and clean. But a hard toothbrush wouldn't do that, right? And it will even affect your teeth. So soft toothbrush, fluoride-containing toothpaste, and then flossing. Now, as you know, teeth are usually close to each other, right? And those parts a toothbrush usually can't reach. Now, that doesn't stop the food from sticking there. It won't be like, the toothbrush can't reach here, I'm not going to go. It will still go. So flossing removes that food that is stuck, but it also kind of nourishes the gums and keeps them healthy, right?
Those who may not understand, we may go so fast, we may be so much of uptown. And if my producer has any picture of the flosses, how they look like, they usually have like threads. Others are threads, others are sticks. In fact, others now even resort to having like a thread, a real thread that you just eat
and use. Yes.
Okay. Yes.
So the floss is basically a piece of thread that you pass between your teeth, right? And what that does is it removes whatever might be stuck in your teeth and keeps the teeth healthy.
When you see blood, I've seen people that when they floss, they see blood.
No. Well, like we said,
that's what you're seeing in your screen is what we call flossing. Thank you so much, producer.
That's floss. Now, when you see blood, remember we talked about it at the beginning, that when you see blood in your teeth, that is an indicator of not healthy gums, because healthy gums should not bleed, right? They should be brushed, they should be attached well to the tooth surface, they shouldn't be so red. They're usually pinkish, yes? They shouldn't be, if you find that your gum looks very red, there probably is a problem. If it looks swollen, there is a problem. So if it bleeds, serious
wake up
problem.
call.
Yes, so you just go and see the dentist and they can help you fix that, right?
Yes.
But now, you see, if you don't floss, sometimes you can't even know some of those things. So it
Okay.
also helps you identify, things that are wrong with your teeth. Or sometimes you can floss and the floss gets stuck between your teeth or comes out torn. That could be an indicator of a cavity between the teeth. So it's also a way to find out what's wrong with your teeth.
Okay.
But mainly, it removes anything that could be stuck between the teeth and nourishes the gums, just keeps them in a healthy condition.
Okay.
Then
Mouthwash.
mouthwash. Now, mouthwash is just an added
Dessert, basically.
yes,
Let's
it's
call it
like dessert for the toothpaste, right?
Yes.
And you should use when you go to the shelf to buy your mouthwash. Which you shouldn't really be buying mouthwash if it's not recommended by a dentist.
Okay.
But when you go to the shelf, it should also have fluoride, right?
Oh.
Yes.
Sorry, it's good to read those words.
Yes, because now you see for the toothpaste, you brush, rinse it out. What the fluoride does, what the mouthwash does, you don't rinse it out. It's like a rinser, right? So you use it and spit. You don't again use water.
Oh,
so
true.
now that kind of keeps the fluoride there to enter into the tooth surface and make it stronger. But what happens is that most of the shelf mouthwashes have alcohol in them. And that is not good for the teeth because it will kill all the good bacteria and let the bad bacteria thrive, right? So don't just buy a mouthwash. Yeah. Again, this is where our visits to the dentist come into play. You go to the dentist, they recommend a mouthwash that you can use if you need one. If you don't need one, they tell you what to do.
Okay.
But if you just go on the shelf and buy this and that,
Because my friend uses it, I went to her house, she's using it, I should also use it.
no, yes. So if you just go ahead and do that, you could cause more harm to your teeth,
Very
right?
true.
You'll find that ever since I started using this thing, my teeth have become more
worsened.
sick, or they are now becoming sensitive and all of that stuff. So mouthwashes should ideally be used on prescription, but if you have to use one, ask for a recommendation from a dentist.
Wow.
And it should not have alcohol, have fluoride.
Okay, that is very thoughtful. Thank you so much, Dr. Angela. That is something that, us as Ugandans or as people, we really love buying things because someone has bought it. Bandwagon. Chirindi.
Hey.
That's how they call it. Again, I said a lot of new things have come with dental care.
Yes.
You see people nowadays in their handbags, in their offices, they have that they spray. Now that nowadays even the eyes, they want them white.
Yeah.
What is that they spray inside their mouth? I've never asked. And I have a friend close to me. She really uses it, but I've never asked, let me read. I'd be like, what is it? Why would someone have that? If you don't trust your mouth, maybe.
Yeah, usually it's because of maybe bad breath.
But what is it? Because I've just described it, but I don't know how
they are. I don't know how to call them, but they're like mouth perfumes.
Mouth perfumes. Usually, if I have do you have like is that an inhaler? Because they are colored. They look nice as well.
Yeah, there is inhalers, but I don't think that's what they'd be using.
Okay.
Yes, but I think they're like mouth perfumes of sorts. I had a friend that had one in high school.
Yes.
And she would like give everyone to just spray. And like I've seen a lot of them in movies, especially. I've not come across one physically, but usually those are for people that have bad breath, and they're not usually prescribed. Yes, by the dentist. So even them, they should go to the dentist, show us what they're using, so that we tell them if it's the right thing. Because you could be using this thing because it's giving you a temporary solution, but harming your teeth in the long run. So yes, whatever you are using, make sure that it is approved of by the dentist. Or even, if you cannot afford a dentist, look on the internet.
Doctor, we discourage internet.
No?
We discourage.
No. Some of these things, like for example, from the information that I have given of fluoride, right? Find out if this product that you're using has fluoride. Okay. For example, there is dental associations. If you are checking on the internet, find out if this information is coming from a dental association, not just everything Google and, yes. So most of the information.
Disclaimer.
Yes.
Okay.
If you go to the internet to
search for
something, make sure that it's verified by an association that is, dental association or medical association.
From a genuine source.
Yes, a genuine source. Because there is a lot of information over the internet. You can go with a stomachache and they tell you have cancer. But but if you are using a toothpaste, find out what does the Dental Association of Uganda say about this. Do they recommend organic toothpaste?
We have seen the organic now.
From
There's
charcoal.
also black one, charcoal. There's also banana.
Yeah, so you find out, do they approve of these things, or are these for just pushing their products?
Very true.
And if they don't, because not everyone is going to be able to get access to a dentist, but they have access to Bethany TV or a radio station out there, or a smartphone, or internet. So the disclaimer is that let that information be verified by an authentic source.
Okay.
Not just Google.
Well, would like to, as we are winding up, what are your last remarks?
Well, I'll just...
as a dentist, before you go as a dentist, there are people who use charcoal. Yeah. Real charcoal, meanwhile.
Yeah, true.
They get the under,
and they brush their
put their toothbrush, and... Is it recommended?
No.
Thank you. No, that is enough.
Sorry, toothpaste, please. Yes.
That is very right.
Yes.
Your last remarks. As a dentist, how often do people come to check, Have the population grasped dental care? Oh, we are still backward. That's why we are still bringing this information.
We are working on letting people understand that it's not just teeth. It's at Cord Clinic we say we are teaching our patients that it's oral systemic health, right? Okay. Oral and the entire
whole system, your body.
The whole system. It works as one huge system. It's not just, oh, I don't have high blood pressure, but my teeth are okay.
True.
So what I can say is that the whole body is connected, right? Okay. One thing leads to another. If you have very sick gums, it can actually cause heart disease, right? In fact, studies have shown that 50% of heart disease is caused by people having gum disease, right? So you'll find people that get strokes out of the blue. Like, I don't have any problems, I don't have any chronic diseases, but I got a stroke. Have you checked your teeth? So it's...
Doctor, that is new.
Yes, it's connected.
Okay.
Like we said, oral systemic health. The body as a whole, the mouth is the gateway to it. If your mouth is dirty, that's an indication of how the rest of your body is going to look.
True.
So take care of your mouth.
Now that you have reminded me before we go, we talked about the tooth aching you and you get a headache. So that's now I'm grasping that it's a whole body system.
It's a whole body thing. Otherwise it would just be the tooth alone in the mouth. Nothing else is hurting. But you find that your tooth is hurting and you cannot sleep. You have a sleepless night. So take care of your teeth. Go for those appointments. Make sure that you go and have your teeth checked. Make sure that before you use a product, find out, is this what I'm supposed to be using? And, just generally brush, floss, go for your appointments, and, you'll have a very good and long, healthy life.
Thank you so much, Dr. Angela Kisak from Cord Clinic. Yes, that has been our time. We'd like to sign out, but do remember tomorrow is Sunday. Make sure you go to church. For me and the doctor, we're out.